department here locally. She supervises a number of people. She's implemented multiple program evaluations, quality improvement initiatives, and community needs assessments. And in her talk, she'll explain more what that means. She works monitoring and reporting the health of Pierce County residents and shares data with us about that to help with our planning and practice. She has a master's in public health from the University of California. I'm from UCLA, I'm not a California girl, and USC. And I have been volunteering under Cindan for the last few months, and I've enjoyed every minute of it. I'm very, very lucky to know her. Anthony Chen arranged the volunteer arrangement for us, and he's part of Rotary 8. He's the director of the department. And I met Cindan's daughter the other day, and she's the most cute, feminine little girl I've ever seen.
Thank you, Kathleen. I'm very pleased to be here. Thank you to Kathleen for inviting me, and thank you all for hosting this talk. Public Health is very proud to be a partner with Rotary Club. You all have done amazing work to improve the health of children across the nation and across the world. So on behalf of all of my public health partners, I thank you for all of the great work that you have done. I've been a resident of Pierce County for about 13 years now. I'm very proud to call Tacoma my home. I live on the north end of Tacoma, and just love it here, love it. As Kathleen said, I lived in Los Angeles for about 10 years, lived in Northern California in the San Francisco Bay Area, in the wine country of Sonoma, which is beautiful, but I'll tell you, there is nothing like this community. This area has such a strong sense of community, so I'm very, very proud to be called a Tacoman. So I'm going to talk to you today about the health of Pierce County and a little bit about the health of Tacoma. I'm going to explain a little bit about what we do at the health department, talk to you about some of the health status data that we collect and analyze at the health department, and touch upon a few of the key health issues to residents here in the county. I will talk a little bit about the differences between Tacoma and Pierce County in terms of health status. And then I'd love to open it up and just answer your questions or listen to your thoughts about the health of this community that we all live in. So first, a little bit about the health department. As Kathleen mentioned, our director is Dr. Anthony Chen, and he is a proud member of Rotary number 8. And we are actually an independent local governmental agency. We operate under an interlocal agreement between the city of Tacoma and Pierce County. So we are not actually a department of Pierce County. We're our own separate agency. We report to a board of health, which is made up of county council members, Pierce County council members, Tacoma city council members, the mayor, the county exec, and a member of representing other local cities and towns, and then a member from the Pierce County Medical Society, and they are our governing board. We have about 260, 270 employees, and our main office is located on Pacific Avenue at the corner of South 38th Street. We are your health department. We are the local source of health data, health services, public health policy for Pierce County, and probably most, if not all of you, have interacted with our health department at one time or another. If you ever needed a copy of your birth certificate and you were born in Pierce County, you got it from us. If you ever needed a permit for a well or septic system, you got it from us. Maybe a relative of yours benefited from some of our maternal child health programs, our nurse home visiting programs. So we have a wide range of services that if you haven't obtained services from us, probably you know someone who has. So our vision is healthy people and healthy communities here in Pierce County. Our mission is to safeguard and enhance the health of Pierce County residents. I am with, as Kathleen said, the Office of Assessment, Planning, and Improvement. And what we do there, we fondly call ourselves data geeks. We love data. And so we have epidemiologists. I'm an epidemiologist, which means I study the health of populations. We do a lot of data analysis. We conduct needs assessments, so we do this both for the health department and other agencies in the county contract with us to provide these services. So we will look at data, we will go out and collect data to better understand the needs of the county residents around health and social issues. We also do program evaluations. We have limited funds at the health department, as do many nonprofit agencies in the county, and we help those agencies and the health department understand, are our programs working? We want to use our tax dollars effectively. We want all of our programs to be effective, so we provide the evaluation of those programs. We do a lot of surveys, questionnaires. We have a GIS mapping expert, so you can see in the photo we're looking at a map of Pierce County trying to understand the geographic differences. We do a lot of quality improvement, not only for our county, but for other health departments across the nation, and strategic planning. So just to let you know, we do have a lot of data and reports on our website, www.tpchd, which are the initials of our organization. So if you ever are interested or need health data, I also brought my business cards, and you can feel free to give me a call or email me, because we really are the repository of much of the health data for Pierce County. I mentioned that we provide services to other organizations, and here's just an example of some of the organizations that we've worked with. For example, First Five Fundamentals, because of your association and work with children, you may be familiar with this group. It's a coalition of many groups. It's affiliated with the United Way, and their goal is to have the best early childhood education and child development for kids ages 0 to 5, because that's such a crucial age, really, for the health of people, to have that early learning and positive child development from ages 0 to 5. So we provided program evaluation services to them. Carol Milgard Breast Center, they came to us asking us to help them better understand the need for mammography services in the county. And because they have limited resources, where should they target their marketing efforts and their services? So we did an analysis and identified certain populations that are at greater need for mammography services, and presented the information to their board. And as a result, they did make some changes with their marketing strategy as well as their services. And now they've come back to us, I think about 3 years later, asking us to re-look at the data to tell them if the trends have changed or if they're still targeting their services appropriately. So that gives you an example of some of the work that we do. What I'd like to share with you today is 2 different data sets. So we deal with a lot of different data, and sometimes it's hard to kind of, put it all together and get a picture of the health of Pierce County. But one of the data sets I'm going to talk about, they're called the County Health Rankings. And this is a set of what we call health indicators to give people an understanding of how is the health of their community. It's sponsored by the Robert Wood Johnson Foundation. So what the County Health Rankings tell us about Pierce County is that when you look at the length and quality of our residents' lives, these 3 areas are areas where we actually perform or are worse than the state average. So we have a higher rate of preventable deaths. We have a higher rate of poor physical health days. So people who report that they have days in which their physical health is not well. We have a higher rate of poor mental health days than the state average. In the area of health behaviors, we have a higher rate of adult smoking. And adult smoking is the leading cause, what we call the leading actual cause of death. It contributes to the most deaths compared to any other cause. And so a higher rate of adult smoking probably has something to do with the worst rate of preventable deaths. We have a higher rate of adult obesity, and we have a higher rate of some sexually transmitted diseases. So you can see we have our work cut out for us here. In terms of clinical care, we have a worse ratio of people to primary care physicians. So in other words, compared to the state, we have fewer primary care physicians for our population than do other populations. We also have more preventable hospital stays. So what that means is more people are going into the hospital for health conditions that really can be served in an ambulatory setting, in an office setting. And we have a worse rate of diabetic screening. So the diabetics, people who have diabetes, are not getting screenings at a rate that other people in the state are getting. Social and economic factors. I put this up here because it is one of the areas in the county health rankings, but sometimes people don't understand the relationship between these things that are up on the screen and health. But actually there's a very, very strong relationship between education, employment, income, housing, crime rates, and health. We call these things social determinants of health. And there's a lot of evidence out there that shows that these things really have some of the greatest, they're the greatest predictors of health. If you have a highly educated population with high incomes, you're going to have better health outcomes. So again, Pierce County has a lower high school graduation rate, and I understand that you do some great work with Lincoln High School in terms of providing scholarships for those kids to go on to college, so you are directly contributing and improving the health of Pierce County residents by doing that. We have a higher unemployment rate. We have more severe housing problems. And that relates to housing that doesn't have adequate plumbing or adequate kitchen facilities. And we have a higher violent crime rate, and that is especially true in Tacoma. Our physical environment, so our area where we live has a lot to do, and how our environment is built has a lot to do with people's health. So the more bike lanes that we have, the more sidewalks that you see, that actually does have an effect on people's health. And so we have longer commutes with single drivers. That's probably not a surprise to many of you. And a factor called our food environment is actually worse in Pierce County than the state. And what that means is that we have more fast food restaurants per population in this county. We have fewer full-service grocery stores that have produce and healthy meats and produce, etc., in low-income neighborhoods. So that's another problem. So I apologize for focusing on the negative, but I know that your organization is so dedicated to improving health and wellness of residents here that I kind of wanted to paint a picture for the challenges that we have before us. The other data set that I want to talk about comes out of our Pierce County Community Health Improvement Plan. So our department partnered with University of Washington Tacoma, Multicare Health System, and the Franciscan Health System to conduct a countywide community health assessment, and then based on the data from that assessment, we developed a countywide health improvement plan. And so I'm sharing from that process. It was about a 2-year process where we and our core partners that I mentioned met with many people. We did interviews with leaders throughout the county. We met with many community groups and locations throughout the county, and we asked them, what are the greatest health needs of Pierce County? And then we looked at a lot of data like the ones, the indicators that I was just talking about. We looked at death rates. What are people dying from in our county? We looked at disease rates. We looked at health behaviors to help us better get a whole picture of the health of Pierce County. And this is a graphic that kind of depicts the methods that we use, the qualitative and the quantitative methods that we use to collect the data. And these were the key findings. So we had 5 areas that rose to the top that we kept hearing about over and over again, and that the data showed were areas of need in the county. And again, I don't think any of these will be a huge surprise to you. Number one, mental health. That came up in every setting. At any kind, we did 4 different kinds of assessments, and I won't go into sort of the methodology, but in each assessment, that rose to the top. We have real need statewide and in the county around mental health services, but also looking at the entire population and our rates of depression. That's also an issue for us. Number 2, substance abuse, which has a strong tie with the first topic, mental health. The interesting thing about substance abuse, and I'm going to share just a little bit of data on each of these, but that was the one area where the data, the health indicators, actually don't substantiate that that's a real need. In other words, our rates of substance abuse, alcohol use are actually, not too bad. I'm not saying they're great, but they're fairly comparable when you look at our trends and how we do compared to the state. But people talked about this. This was high on people's minds, on leaders' minds, on residents' minds. There's a perception that that's a huge, huge problem in our county. So we can't ignore that. We just can't ignore it. So that was number 2. Health disparities. Health disparities talks about how there are differences in health among different populations. So I mentioned some of those earlier. People with lower incomes have worse health outcomes. People who have lower education levels have worse health outcomes on average. There are different populations, racial ethnic populations who have worse health outcomes. And there are different geographies in the county where people have worse health outcomes. Those are those disparities. So those came up especially around health behaviors and chronic disease rates. And then access to quality healthcare and services. So this is a lot of the related to the healthcare system. I understand you had a talk last month which kind of looked at access to healthcare. So that's what that's about. And then protecting and improving the environment. So that came up a lot around our air quality issues. Who's familiar with our non-compliance issue? Does anyone, yeah, that we're out of compliance with our air quality in the Tacoma area. We're out of compliance with EPA standards, and there's a lot of work trying to address the number 1 cause of that, which is wood smoke. Oftentimes people think it's the port that's contributing, but actually the number 1 reason why we're out of compliance with our air quality is people who use wood smoke to heat their homes and in their homes. But also protecting and improving the environment relates to what I was talking about before. We call it our built environment, the sidewalks, the bike lanes, the location of grocery stores, those things that we actually have control over, that our local politicians and our city and county planners can plan for. So those are the key findings, and I'm just going to very briefly just show you some of the data to kind of show you what I'm talking about. So for example, here's the percent of youth who report depression. This is among 10th graders. You can see girls have a higher rate, and this is actually true, you see this consistently statewide and nationwide, that girls report a higher rate of depression. But look at that, more than 40% of girls and about 25% of boys say that they are depressed or they have been depressed. That's pretty high. Here's adults, and you can see with income, as income increases, depression decreases. You can see it's almost, direct correlation there. And then here's a quote of what we heard about mental health. So this quote was from one of our community workshop participants said, "My husband came back from the war broken, and now it's my job to fix him. There's a lot of stigma attached with the possibility of mental illness." So we have Joint Base Lewis McChord here, and that introduces some special needs around mental health issues for our community. Substance abuse, as I mentioned, there actually is no data. I can't present to you any concrete data that shows that this is a huge problem for us, but this is very typical of what we heard. We definitely have a severe drug problem in our community, especially with teens. That was very common. And then usage of marijuana, which is on everyone's mind because of the recent laws. That was a really big issue for folks. So it seems to be accepted and considered an average or a normal thing to do in this community, but it may lead younger generations to attempt to try other drugs. So those are the really, really big concerns our residents have. Here are some examples of health disparities. So this is the death rate from all causes among men, and you can see American Indian, Alaska Natives have a higher rate. But among women, it's actually a little bit more even. So interesting, this can vary by gender. Infant mortality, we have higher rates among Black, African American babies. That's a big issue that we're trying to deal with in the county. Same with low birth weight. And then self-reported health status. I just wanted you to mainly focus on income and education. Again, here's an area where, and this is people reporting, you know, how good is your health? So they're self-reporting it, and it definitely gets worse. So this is the percent of people who say they have poor or fair health. So it gets worse with lower incomes and with less education. I'm going to skip through just because I'm a little bit short of time and I want to give you an opportunity to ask questions. But again, you know, here's an example of access to care, people living in rural communities, transportation cuts makes it harder for people to access care. And then around protecting and improving the environment, this is a fairly complicated graph that talks about our air quality, how many days we had a higher rate of particulate matter and we're out of compliance with the EPA standards. And again, a lot of people concerned about air quality in our area. So I mentioned that geography matters, place matters. Where you live really is a big determinant of what your health is like. So I know this map is going to be a little bit hard for you to read, but this looks at poverty levels. So this map tells you where the large pockets of poverty are in our county. So the darker color, the darker brown, indicates more poverty. So you can see that, for example, this is Salishan, East Tacoma. This is up around Hilltop. You know, this is Parkland, Spanaway. You've got Tillicum down here, South Tacoma. That's really where you see the biggest pockets of poverty is among the urban Tacoma areas. Here's life expectancy. So where you live, it determines how long you're going to live. So for this, you're looking for the dark red or darker colors have the lowest rates. So this is, for example, this area right here is where people on average lived between 61 and 70, compared to the green areas, North Tacoma up in here, where people have a life expectancy between 85 and 103 years. Big differences, big differences. It's complicated to try to figure out why that is and what we need to do about it. Heart disease rates, it's sort of an equal opportunity killer. We don't see as much correlation with geography and with income, so interesting. So what I shared with you today, it's just a glimpse, just sort of touching upon some of the main health issues in Pierce County. What I'd like to offer is if you're interested in this topic and want more information, please feel free to contact me. I have business cards with me. I also can email this presentation to you if you're interested. If you're interested in knowing more about the kinds of services that we provide with needs assessments and evaluations, quality improvement work, please feel free to contact me. So again, I hope I've given you just a little bit of a taste of kind of some of the big health issues that we're dealing with, both as a health department and as a community here in Pierce County. And I would love to know if you have any questions about this. Yes?
Just a couple questions. One is, this data study you did was Pierce County versus other counties in the state, correct? Is that
yeah, that particular data set, yes, did compare Pierce County to other counties.
Two questions.
Yeah.
Do you have a way to measure bigger cities versus other bigger cities and how Tacoma does versus Spokane versus Vancouver versus Bellingham?
We do, and I don't have the data with me, and again, it just sort of varies from topic to topic where we do worse or better. But you're right, that is another valid way to look at the health of Pierce County.
And lastly, thank you. Speaking of better, can you
Yeah.
give us something positive that Pierce County?
I know, I knew someone would ask me this. Okay. Something positive. All right. Let's see. I brought the data. Oh, so, okay, something positive is we do have greater access to exercise opportunities. So think of our hikes, our trails, the natural environment here in Pierce County, the dragon boat or racing, we have access to water, so we have a lot more opportunities for physical activity. There are a lot of areas where we're the same as the county or as the state. And I also, I should mention, when you compare Pierce County to the entire United States, how is our health compared to the entire United States? That's when we look good. That's when we look pretty good, because the health of the United States, is affected by, think of the Southeast, really the whole South. They typically have worse health outcomes. Some of the rural areas in the Midwest, and so that kind of brings the health status of the United States down, and we actually look okay compared to the United States. Great questions. Yes?
Your book, I and a few others in this club have read, is a book called The King of Bethlehem, written by our Pierce County prosecutor.
Yes, okay. Right, now I know what you're talking about.
And he talked about Pierce County at one point being the worst county in the country for methamphetamines.
Yeah, that's an interesting
story. You could talk a little bit about that, because it can't possibly be as bad as it was before.
No, it isn't. It isn't. And I don't have time to go into the full story, but you're absolutely right. We were at one point sort of we had the highest rates of methamphetamine drug labs in the county, and so there's a combination of efforts through law enforcement. We were actually involved in that as well, because it's our responsibility to clean up the homes when they are contaminated with meth labs. And from what I understand, it was a combination of drug use going down and the drug labs being pushed out of the county. So some counties were mad at us because we were basically pushing our problem out to them because we had such strong law enforcement. Real quick, I'll mention, we've been working quite closely lately with the Tacoma Housing Authority and helping them do assessments of their properties and testing for methamphetamine to try to find out, are there any labs in public housing in Tacoma? And interestingly, this has made the paper, so it's not a secret, but they had a fairly high rate. They found a lot of methamphetamine use, and so we've been working very closely with them in order to determine at what level do you need to clean it up, and they have evicted people on the basis of finding that, and they're feeling really good about now having sort of a better handle on the problem among their housing. So it's an interesting topic. One more question, sorry, but feel free to email me with additional questions. Yes?
I was just curious how our health in Pierce County has trended over time. Are we improving? Or?
We're generally improving over time. So, and this is consistent really over the whole state. The health of the state of Washington is improving overall. So greater life expectancy, lower rates of diseases and deaths due to cancer and heart disease, partly because of the technology and treating people, but also because people are stopping smoking. That's a big factor, because the rate of smoking has gone down tremendously in the last 20, 30 years. So good question. Thank you so much, and I'm going to hand the microphone over to Kathleen.
Just wanted to mention one more thing. As you can tell, Cindan's and her group are very impressive. Businesses can hire their services to do surveys, to do assessments, or to do evaluations even of your business. So I just wanted to point that out. Cindan doesn't shine her star a lot, but they do excellent work.